Professor Sly? And you're on mute, Professor, just in case you're trying to speak.
Hello.
We can see you, we just can't hear you. You're on mute.
Okay, is
Great.
that better?
Perfect.
Sorry, little bit of a problem with the technology. I'm not used to WebEx. Okay, so my name is Professor Peter Sly. I'm here. I'm representing the Academy of Health and Medical Sciences. I'm a paediatric respiratory physician and an environmental health researcher and specialist. My work focuses on how early life exposures to environmental pollutants can affect children's health throughout their lives. I also serve as an advisor to the World Health Organization in this area, particularly on environmental determinants to non-communicable diseases. I'm also deeply committed to improving the way we translate complex science into public health action. I'm here representing the Australian Academy of Health and Medical Sciences. The Academy is Australia's only learned academy for the health and medical sciences, acting as the nation's expert independent voice for health and medical sciences expertise. It brings together 526 of Australia's most distinguished health and medical researchers, clinicians and innovators. Our work is grounded in the building the future fit health systems, strengthening trust in health and medical science, and ensuring equity and access to health and medical expertise. And you can tell I didn't write that. Would you like me to give the introduction of what I was going to say?
Yes, please. I'll invite you to make the opening statement.
Sorry.
And then we'll go to questions.
Yep. Okay, so in December 2024, the Academy made a written submission to the inquiry, and I was part of that, as was Professor Anne-Louise Ponsonby, who was supposed to appear today, but she has illness in her family and isn't able to join us, and she sends her apologies. So we argued that PFAS exposure represents a persistent, complex and inequitable public health challenge in Australia. While there is scientific uncertainty, and we need to acknowledge that, it mustn't delay action. We need to follow the precautionary principle to guide our responses. And I think I'd take that one step further and say one of the problems we have in science and in science communication and in environmental health in general is we have the onus of proof on the precautionary principle backwards. Companies, manufacturers are allowed to introduce chemicals into our environment, and it's up to us later on to prove there's something wrong with them. Where it should be the other way around, they should not be able to introduce something into the environment, particularly for children, unless they have proven that it is safe. And I think it's important to remember here that these chemicals, PFAS and associated chemicals, should not be in our bodies at all. They play no role in normal body functioning and can only do harm. And this is unlike some of the other environmental toxicants that we worry about, things like, for example, metals, copper, zinc, even iron. They have a role to play in our body. They're normal levels in our body. These chemicals don't. And so we should be starting from the viewpoint that the level in these bodies should be zero. And when we come to talk about our recommendation number 4, I'll remind you of that. So the recommendation from the Academy of Health and Medical Sciences to first of all establish a national biomonitoring program to track the accumulation of PFAS and other chemical contaminants in Australia. There are ways that this can be done. It doesn't have to be individual person testing, and we can talk about that. This recommendation number 2, to immediately begin monitoring pregnant women's exposure levels as an interim step, because it's the early life pregnant women, and particularly the developing fetus, that is at most risk and where most of the evidence, the adverse effects of PFAS is. Recommendation number 3, to expand research into the health effects of PFAS exposure, especially impact during early life. And one of the things that, if you look at the literature, where a lot of the studies that don't show an effect are cross-sectional studies. The studies where they do tend to show effects are more longitudinal studies, particularly in cohorts. In Australia, we have a long and very proud record of longitudinal birth cohort studies, and we've made a lot of advances in knowledge through these mechanisms. And then recommendation number 4 was to regularly review and update the legal limits for PFAS exposure based on emerging evidence. And as I said, I think the level should be 0 until someone can prove that it's actually safe to have any PFAS. So these recommendations aim to support long-term coordinated action that's transparent, science-led and responsive to the need of affected communities. We welcome the opportunity to expand on these points, and also happy to respond to questions on related areas where I can be of assistance to the committee.
Thank you very much. Senator Pratt.
Thank you. So in terms of getting an interim program monitoring pregnant women's level of PFAS and other chemical contaminants, how would we go about doing that? How do we make it as easy for the bureaucrats to recognise that, yes, we should be prioritising that? What do you think our barriers are going to be to getting a recommendation like that up? And
I think the barriers are several. First of all, it's actually easier than you think it is, and most people will. The barrier is that how are we going to do this in pregnant women? All pregnant women have blood tests during their pregnancy.
Yes.
At the very least, they have a glucose tolerance test around about 36 weeks gestation. Almost all women have blood tests earlier in pregnancy, and if it was routine practice to order this and yes, fund the test, I heard what the previous witnesses were saying, then that could easily be done. It could be done tomorrow.
Now, are we doing this just for research purposes, or are we actually doing it to mitigate risk and to intervene in pregnancies where we've seen an elevation? Because, of course, you would want to see surveillance in a community like Wreck Bay compared to other levels of contamination. I feel like it's likely that if government says, OK, well, we will start doing this, that they won't necessarily start with universal surveillance. How would you frame that?
I mean, let me say, one of the things that you touched on there, I think you're exactly right, is you need to know what the baseline levels are. You need to know whether someone does actually have an elevated level or not. And so wider community biomonitoring will tell you that. But yes, I think you could easily start in affected communities. But also the second part to that is that if you determine someone's got an elevated level, you need to be able to offer them something. Yeah. And I'm not sure that we actually do have anything to offer. I'm not sure how we would know how to reduce PFAS levels in somebody's body. I'm not sure that the technology is actually there to do that. But if you don't start collecting the data, we will never know. So, yes, it's partly research, but it's research based in the understanding that we need to be able to determine what levels, what the effects of different levels actually are. And so there's not just enough to do the blood test, you've then got to follow the children afterwards. And that can be done. That can be done relatively easily through maternal and child health centres if they were set up the right way.
So
perhaps one of the other...
a longitudinal study. Are there other studies of children that this could be attached to? And
Yes.
In addition, you know, there are lots of different parts of medical science that say, please test for this, please test for that. And government says, well, look, we can't do everything. How do we... what's your assessment of how important this could be for children relative to other types of testing that might be coming through, and how do we make a case around it?
Okay, well, let me give you an example. 10 years ago, the same arguments were being had about bisphenols and the plasticizers. And we now have irrefutable evidence through our longitudinal birth cohort that's being run out of Geelong, known as the Bouwhuis Infant Study, and Professor Ponsonby is one of the co-leads of that study, and she, I'm sure, would have been able to talk about this more. But they now by monitoring the levels of the plasticizers in the maternal blood during pregnancy, and following the children output, we've now published 4 or 5 high-impact papers showing the impact on autism diagnosis at the age of 9 from these plasticizers. So we actually have the data on a lot of these children. We have the samples. The PFAS could be measured in the samples we already have. There's only 1,000 children, but it would give you a good indication of what you might be able to look for. Now, the points being made
that could inform the next decision as to how to scale up from there.
Absolutely, how to scale up as to which areas you needed to look at. The point's been made that PFAS testing is tricky and not cheap, but there are plenty of analytical laboratories who actually do know how to do these things and could be engaged. One of the points you made about knowing the background levels and how do we get these data? We've developed relationships with pathology groups in Queensland with Sullivan and Nicolaides, for example, and we can get leftover blood and urine samples which are pooled, de-identified, and we've used these to monitor levels of plasticizers in the population in Queensland. This is a technique that is it's cheaper because by pooling samples, first of all, you protect individuals' identity, but secondly, you only have to measure one sample rather than 10 or 100, and you can get levels across the population. The groups that are also using these same techniques for monitoring wastewater, and they can tell you about the levels of different drugs, for example, the SSRI antidepressants. You can monitor where the use is around the country based on things in water. Yes. So these same things could be applied here, because while the concentrations of PFAS and things are low, they're measurable. So you could a biomonitoring program could have several levels to it. You know, population level through leftover samples. Now, you may not realise, but whenever someone has a blood test, there's always more blood than's required, and that blood is held by the pathologists, whether they are in hospitals or in private, for a number of days in case the doctor rings up and said, "Oh, I forgot I needed this as well." And those samples are then normally discarded, but they can be ethically obtained and used for these sorts of biomonitoring programs.
Are they used for other research purposes currently?
Well, we have been using them in conjunction with people in Queensland for looking at plasticizers. We've been using wastewater
Does that require individual consent from those people who've opted? Great, it's really good to know. I support that kind of approach, but I just wanted to check there are barriers.
Because the researchers, all we can get access to is whether the pools came from males or females, the age of the people, and what the test was done for. You can't get any other identifying information. In very small communities, you may have there may be some limits, but in general. But we've used the wastewater approach for looking at disinfection byproducts in Queensland water in the different regions around Queensland in conjunction with the water authorities.
And
so people do this.
I'm really pleased to hear that. How might we apply similar types of approaches in the long term to data inside my health record when that becomes available for research?
Okay, so if we're looking at sort of future, where we have an idea of, you can have a map, for example, of what the PFAS general PFAS levels in the population was in different parts of Australia. And you could use it a little bit like a growth chart from childhood, where you get your height and weight measured and they're plotted on a chart, and you can show whether you're average, above average, or below average.
Yeah.
This still wouldn't tell you whether there were adverse health effects, but it would at least be able to. Someone mentioned earlier being able to mark you against the population. Are you at more risk than everybody else?
Okay. So if someone has a child of a low birth weight, should they get their PFAS levels checked? Is it too late by then?
Well, I prefer that they had their PFAS levels checked before they had the baby, but at this stage, I'm not sure we can actually treat PFAS.
Yeah, no. And apart from contributing to the science around it, which might be a good reason to do it in any case.
Yeah. Okay. So, what it would contribute to is it would allow us to be able to change the regulations and show that over time the levels of exposure were coming down. Okay. If the levels of exposure come down, then the health effects will come down, and
yeah.
Unless someone was able to come up with a treatment to be able to remove the PFAS, then it would be difficult. There are precedents for this. People who have high levels of lead in their blood can have chelation treatment, can have their blood filtered and put back. I'm not aware that there's been any research or any science looking at that for compounds like PFAS.
Well, are you aware that some plasma donors donate plasma in order to lower the levels of PFAS in their blood, but that the regulators and organisations collecting that plasma say it's better to have the plasma regardless of whether it's got PFAS in it? What do you make of that?
Yeah. Well, yeah. If you need plasma because you're of your medical condition, then you're better to have what's available. It's a little like breastfeeding children. Breast milk is contaminated with chemicals, but it's far better for the baby. The breast milk's far better than the baby than the chemicals that are in it.
Would it not be better to encourage more blood donation, but also to screen, use blood donation as a source of surveillance?
I mean, that's another thing that could be done. I'm sure you're aware that when blood is donated, it's screened for a number of mainly infectious agents. It would be possible to screen for PFAS and use the lowest blood if you had enough available.
I don't know enough about plasma to know whether it gets mixed up with other plasma or if it comes from a single patient, for example, but I'll ask the other. But if you already had high levels of PFAS, you wouldn't want to get PFAS from yes, you might need a train, but you wouldn't want to elevate it.
No, you wouldn't. But then again, it's probably likely that the reason you need the plasma, you need it, and you may not have that choice. If you had the choice, of course, you'd take the plasma with the low levels. I don't think the Red Cross has enough.
No, that's right. But should these kinds of procedures be made available for therapeutic purposes, or is there not enough evidence to demonstrate that yet?
I don't think there's enough evidence to demonstrate it. I mean, these things are generally in the lipid. They're lipid-soluble chemicals, so the levels in the blood only they don't totally reflect the body levels.
Okay, but surely if there are people with PFAS donating plasma, that is a reason to have some surveillance so we can know if it has therapeutic benefit or not. Yeah. How would we answer that question?
Senator, I'm afraid every person in Australia has PFAS in their body.
Yeah.
Everyone has PFAS levels. It's a matter of how high they are.
Okay. And that might be harder to detect in that kind of environment.
In that sort of context. That's one of the reasons why the research is so difficult. You can't have an exposed population and an unexposed population. They just don't exist anymore. We can have lower exposed and higher exposed populations, but we do not have people who don't have PFAS levels.
Where would we go to find them?
God knows.
Antarctica. Thank you, Chair.
Thank you, Senator Pratt. I think there's PFAS in Antarctica as well. I think we've heard previous witnesses say that, so no one is safe.
Probably in the penguins.
Professor, how adequate is the current research program on PFAS in Australia, and how significant are the gaps?
Well, I don't think the current research is sufficient. It's not broad enough, and I think one of the biggest areas that it's deficient in is it doesn't provide populations who believe they're at increased risk with any reassurance at all. And I think that's one of the big things. I mean, this area came to light, I guess, when people around areas where firefighting foam was used for training and airports and things discovered there were higher levels, but they weren't the only places. And I think that what we don't have adequate knowledge of where the true hotspots of exposure are. Some are known, but we don't know them all. And we don't have adequate knowledge of what that's translated into body burdens and what that translates into adverse health effects. And I think we need those three steps because you can't tell someone who's living in an area that's highly exposed, if their livelihood is tied to that area, you can't say, well, you can just move. It doesn't really work like that. I mean, I think we've seen in Australia with lead in Port Pirie and Mount Isa, Broken Hill, the same sorts of issues, and there the evidence is stronger than it is for PFAS. But it doesn't stop the anxiety within exposed communities. And I think we as a research community, we as a country, need to be able to provide more evidence to reassure people or to find out exactly what their risks are. And I think this is where the biomonitoring programs will be helpful. Yeah. Yes, I take the point that one of the earlier speakers said there's no point measuring everybody in Melbourne because it's not going to help those in the remote and exposed communities, but population biomonitoring can help. And I think there are ways that it can be done more efficiently than measuring everybody.
Well, I know certainly the Wreck Bay people do not want to leave their country. No. And it's a cancer cluster. Even the Kardashians want to go out to Wreck Bay. So we found out
For what reason? To visit or to go
for a photo shoot?
Oh, right, okay.
It's a very beautiful part of the country. Professor, the government often refers to a lack of data on health impacts of PFAS as an excuse not to act.
Yeah.
Do you really need to replicate anything here, given there is a lot of international evidence, such as we've heard this morning?
Yeah. Let me make a couple of comments on that. There is sufficient evidence to take action on PFAS. We don't need to replicate everything in Australia. There are unique environments and unique exposures, and we need to understand those, but they're not an excuse not to take any action. The other thing that why we need at least some evidence from locally is that there are individual susceptibilities to the health effects of any exposure. Not everybody is susceptible to getting cancer from tobacco smoke. Not everybody will get as sick from air pollution as another person. So individual susceptibility is important, but we know what our population mix is. We know to some extent what the genetic susceptibility related to your ethnic background is, to some extent. We need more evidence and more information. But no, I believe that we have enough information to be trying to reduce exposures. It would be really good if research on how to remove PFAS from your body was undertaken as well, because that's certainly not my area of expertise. As I mentioned, there is no rational reason, there's no reason for PFAS to be in our bodies. Our body level should be zero.
Thank you. Just have two more questions before we close this session, unless Senator Pratt has a final question. Some witnesses have spoken about researchers struggling to find funding and so are increasingly looking to industry for funding their research, which we know leads to more biased results. Do you have any comments on the level of public funding? I see you smiling there. For PFAS research and the role of industry in this research?
Yeah, look, that's a very good question. I mean, clearly the amount of public funding is not enough. It's not enough in any areas of research. But I would really steer clear of industry funding in this area. It is too open to bias. I mean, we have in Australia have a long and proud record of excluding tobacco industry from any research related to adverse health effects from tobacco. And back 30 years ago or so, when the court cases were going on, it was very clear that the only way we were going to make any headway was to make sure the industry was not involved. And our professional societies, you still have to declare that you have no funding from the tobacco industry before you're allowed to present your research at our professional society conferences or publish in most journals as well. It's the same here. The United States has learnt from their battles with companies like Monsanto and DuPont. It's exactly the same. We cannot take industry funding for this area of research, even though we don't have enough public funding. More would be great, please.
Well, that's the intel we need as a Senate inquiry to, ensure that that's part of our reporting and possibly recommendations. My final question, Professor, is if you could ask for one outcome of this inquiry, what would it be?
A magic wand that we could actually remove the PFAS from our environment, but I'm not that unrealistic. I think one of the best outcomes from this inquiry could be to a very strong statement that these chemicals do not belong in our body, they do not belong in our environment, and we've got to take all actions we can to support those who are exposed to understand what these chemicals are doing to them and how we can mitigate the effects.
You done, Senator Pratt?
That was excellent
Yes.
evidence, thank you. Is there anywhere people can sign up to current studies to participate in them?
Most of the university websites will have a list of what studies that are going on in different areas, and we're always looking for people to be involved. But it's the area of public funding that would help a lot is the
Yes.
cohorts, birth cohorts and things like that, because that's how we learn. It takes time, but that's how we learn. You follow children through until there's an outcome. You look back and see what caused it. It's an area that is underfunded. There is a scheme within the NHMRC that supports this type of research. But more is always better.
Thank you, that was excellent.
And certainly not going to unregulated Facebook posts on PFAS and go to the universities.
Yeah.
Professor Sly, thank you very much for your time today. If you have undertaken to provide additional material on notice, please provide it to the Secretariat as soon as possible and no later than 5 p.m. Monday, 30th of June 2025. And also that includes if there's anything further you'd like to add that you haven't been able to add today, to also provide that. But thank you for your time and your expertise.
You've given me a very open hearing. Thank you very much.
Thank you.
Bye.
We will now have a short suspension while we get the next witnesses online.